Hello, everybody. This is Dr. Adam Rindy, the host of the One Thing podcast. Welcome to this week's episode. This week, I welcome on Dr. Marty Ross. Dr. Ross addresses complex chronic illness that conventional medicine routinely dismisses. This includes chronic fatigue, fibromyalgia, chronic Lyme disease, and long COVID. The main problem is that patients feel terrible, but conventional medicine can't see it on a lab test, so conventional medicine routinely dismisses these patients and gives up on them. Dr. Ross calls this patient population the underdog population. He flags two failures in the standard conventional medicine approach. Specifically, in Lyme disease, he flags the problem with conventional Lyme labs, and sometimes even Lyme-literate practitioners will overtreat Lyme patients by assuming that a positive Lyme test is the underlying cause of the illness. This is a refreshing take, and he helps us understand why that's important to know. Dr. Ross also has developed a framework called the Big Four framework for treating the terrain, not just killing bugs. And he also looks for additional drivers using high sensitivity labs rather than standard labs. He addresses toxin burden and something he calls system dysfunction. And finally, the brain-body feedback loop. You'll have to listen in to hear him unpack these very four important areas of his framework. I've been wanting to speak with Dr. Ross for many years, and I was really pleased to have this wonderful conversation with him. I hope you enjoy it as much as I did. Before we get started, you should know that Dr. Ross selected the Plus One Foundation as our charity of choice for reaching 300 views of this podcast or 300 listens within the first 30 days. We will make a donation to this charity in honor of Dr. Ross. Listen as Dr. Ross shares why this charity is important to him, and after he finishes, we'll begin the episode. Dr. Ross, can you tell us about why you chose this charity?
Sure. So the Plus One Foundation is a Seattle-based foundation that was founded by Casey Kroger, who happened to have traumatic brain injury. And out of that, her difficulty finding services for herself when she was at her worst, she decided that no one should not be able to find the services they need for any kind of neurologic condition. And so primarily they raise funds and they help fund services like horse therapy, water therapy, art therapy, kind of the, I guess I would say, outside the mainstream ways of dealing with these neurologic disorders, but clearly ways that give great benefit to many people, basically. And so it's a small organization. They're trying to help tons of people, and they need resources to do the good work that they're doing. And so I send patients that I have their direction when they need help with things that insurance isn't going to pay, but I think may give them benefit. And Plus One is there for people. And they're Seattle-based organization too, so Seattle area-based organization. They reach the country, though. They help people from all over the country too.
Sounds very meaningful and worthwhile and appropriate for so many people who are needing those services and aren't able to get access to them.
Right.
So thank you. Excellent. This is the One Thing podcast, and I'm your host, Dr. Adam Rindy. The One Thing podcast brings together leaders in functional and naturopathic medicine to discuss actionable information that may unlock puzzles in the areas of gut health, brain health, metabolism, and longevity. Please note, these episodes do not replace the opinion of your doctor. They are not intended to diagnose or treat any condition. Please discuss this information with your provider and discuss your own unique personal health history before adapting this information. Please subscribe to our episodes so that you can stay on top of the most current information in these areas of medicine. Thank you for joining us. Welcome to the One Thing podcast.
Adam, good to be here. And thank you for letting me call you your first name. So that's why I'm not calling you doctor here. But
okay,
I don't mean that as any disrespect. So call me by my name as my first name too. Yep.
Absolutely. Well, I appreciate that, Marty. Well, I want to jump right into this topic. Audience is familiar with your work and the conditions you treat and the framework in some sense. So I'm looking forward to hearing it from you and your unique perspective on multiple chronic illness conditions. So I'd love to hear first about a patient story that really impacted you, someone dismissed by mainstream medicine who recovered once you were able to help them and find the real drivers of what was going on in their chronic condition?
So I'll share a story. This is from my earlier years in managing these types of illnesses. But I had a woman that came to see me that had been doing missionary work. She's in her young 20s, missionary work in Africa. And she had gotten bitten by a tick, had a bullseye rash, got severely ill, had headaches and body pain that would not respond to any pain medicines. She would stop breathing daily from seizures, severe fatigue, couldn't get out of bed. I mean, really bad shape. And the conventional community had given her 1 month of antibiotics and said, guess what? There isn't anything else we can do. And so by the time she came to see me, she was in a bad state. I looked at her. We did have some testing that she brought in that did say that Borrelia, Lyme disease would be a possibility with her. I can't remember at this time whether she had Bartonella, Babesia, the other co-infections that sometimes ride with it too. But we did put her on, I did get her on, she was so severe, I did put her on IV antibiotics. That's where I went at that time. I might even consider herbal antibiotics at this point in my career. And so we did that, various antibiotics, tried to cover all the bases for the various infections, did that for a year and a half. And she got maybe 10 to 15% better and still largely discounted by the medical community. But I had to start thinking, what am I missing here? I mean, I've had this woman on a year and a half of IV antibiotics, various combinations, and we're just not making major headway. And it was around that time that I started hearing about the idea that sometimes people build up mold toxins or Lyme toxins in them. And, these days we have a common knowledge of that. But back then, it wasn't that common of a knowledge. So I'd heard this crazy physician named Richie Shoemaker talk about mold toxicity and Lyme toxicity, and he was giving people this powder called cholestyramine. And I thought, I'm missing something. She was ill enough. I hadn't seen her in a while. We've been doing telemedicine visits. And I finally told she and her family that I need a visit with her. She was too sick to come here. So the family arranged for me to come over where she was. And so I went, but before I could get there, so 3 weeks before I could go see her, I said, try this cholestyramine powder. Just give it a try. And I have to tell you, her husband picks me up at the airport and he goes, you're not going to believe her. You are just not going to believe her. And I said, what? He goes, I'll just wait till you get to the house. So she greets me at the front door with this is a woman that can't get out of bed. Okay. I mean, she greets me at the front door with this big, big smile. And essentially she had gotten 90% better by me thinking maybe we'll try this mold toxicity thing. And at that time we didn't have testing I trusted, but I raised that to say that sometimes what the medical community doesn't understand, we have to sometimes keep pushing those limits. And for her, I think in the end, it was probably, I question if it was even tick-borne infection. I mean, I know she had a bullseye rash. I know she had everything, but maybe in her case, the doxy for 1 month took care of it. And what we were really dealing with all along was mold toxicity. So that also taught me, be careful in your history. And when they look back at it now, they realize that at that time in Africa, her building was full of black mold on the inside. I didn't know what to look for it back then, Now I do it with everybody. I look for it. But yeah. So anyhow, just two things. And it was a combination, going for tick-borne illnesses as well as clearing out the mold took care of it for her as well too.
Amazing. I think that's a perfect example, the terrain and how you worked on the terrain versus thinking there was something to just necessarily kill.
Right. And, even back then, my treatments always, I'm well known for saying to my patients and even physicians that work with me, it's not about killing the germs. It's not just simply kill your germs. You have to deal with the system dysfunctions that happen here, the sleep disturbances caused by this, the microbiome disturbances, the adrenal and thyroid disturbances, etc. We have to approach all those. And I had been approaching those with her as well, too. But for her, it was that mold toxicity was the missing link. Yeah.
Amazing. That's a great example. And it's interesting to think that you ended up, knowing to move into that direction, a conventionally trained provider, right? And how can you explain your path from conventional training to even working in public health legislation, and then now you're dealing with the most complex illnesses that nobody can figure out?
Yeah. There's one common thread, and that is I've always had a mission to help underserved populations, and now I call them the underdog populations, right? And when I first went to I trained in family medicine, or I'm sorry, did medical school at Indiana, and then I went out to Washington D.C. to train in family medicine, but I chose an urban program. Georgetown University ran an clinic in a very underserved ethnically, racially, and financially population. And I went to serve the people. That's why I went out there to train. I was really wanting to be of service to people and help underserved populations. And while I was there, one of the lecturers that used to come in and give our weekly psych conferences was this physician named Jim Gordon. I don't know if you know Jim Gordon's name, but Jim teaches he has a Mind Body Institute out in Washington, D.C.
Yes.
Yep.
Of course.
And teaches food as medicine courses as well, too. Well, Jim used to come in and do these lectures, and he was a psychiatrist who didn't use any prescriptive medicine. So he had moved away from doing anything with prescriptive medicines. He was teaching us about counseling, but also crazy mind-body techniques like doing rapid arm movements and breathing fast through the nose to kind of calm yourself down. And I looked at this guy and thought, this guy, that is just awesome. So in my last year of residency, I wound up working with him. My last year, I could do 2 months of electives, and I did 2 months working directly in his office. And this was, people would come in, they would all get acupuncture. He would do brief counseling with them. He would talk to them about diet and food and do some herbal medicines, and people were getting well. And I thought, wow, this is probably where I want to go, right? I got done with residency. I was still very mission driven, and I wound up getting a couple jobs right out of residency. I worked with healthcare for the homeless on the streets of Washington, D.C. for a 20-hour-a-week job. And I was doing a health policy fellowship with a group called the American Academy of Family Physicians. And I got chosen to work on one of I was working as key public health advisor in the United States Senate for the Republicans on a committee called the Committee on Labor and Human Resources. My boss was Nancy Kassebaum out of Kansas. Opposite her was Ted Kennedy. It was Ted Kennedy's committee. I'm a knee-jerk liberal. Hope no one runs away because I say that. But at that time, Nancy's staff was 50% Republican, 50% independents and Dems. And at that time, people would work together to get the job done. And where we would compromise always was towards the left anyhow, because the Dems were in charge at that time. But I went up to help with healthcare reform. And my portfolio was the Centers for Disease Control and NIH. So I was able to affect legislation and was able to work on healthcare reform. But after 3 years of doing that, I thought, I want to get back into practice. And I was still feeling very mission driven. So I decided to and I wanted to build on my policy background in the Senate. And I thought, one thing I haven't done is managed anything. And so there was a community health center out here in the Seattle area, a group called the Community Health Centers of King County, that was trying to find a family doctor that would help them bring in alternative medicine into one of their 6 family medicine clinics. So these are community health centers, our target work with underserved populations, poor, different racial, ethnic minority groups. But it was interesting is they wanted to set up the nation's first publicly funded integrative alternative medicine clinic. And because of my background and openness of working with Jim Gordon, I got the job. So it brought me out here. And this is in 95, actually. And so we got a grant from King County. And we won the grant along with Bastyr University, so the College of Naturopathic Medicine out here. And we set up the nation's first publicly funded integrative medicine clinic. And what that looked like then is we basically had a bunch of family docs working beside a couple naturopathic physicians, acupuncturists, massage therapists, and chiropractic. And I started seeing, I was like, wow, they're getting great results. I want to start adding this to my practice. And the problem is, in that kind of a setting, the MDs were expected to see somebody every 10 to 15 minutes because that's what the grant money was buying. And I couldn't convince the organization to let me have half-hour to hour-long visits like, you and I need now to really get deep into things too. So in 2000, I finally thought, for me to really expand and work this more interesting and fulfilling way, and I think more helpful way, I need to go into private practice. So in 2000, I did. And I was running a primary care family medicine clinic offering integrative medicine, meaning herbal, prescription, acupuncture, it's all mixed. And I got training in acupuncture. And so it was one of the big trainings I had in integrative medicine. And with that, when I started telling people I'm doing medical acupuncture now, my waiting room started filling up full of people with fibromyalgia, which then brought people with chronic fatigue syndrome, because I consider those an illness with two poles. There's the achy side and there's the fatigue side. And a lot of people are mixed, right? And so in 2000, one of my patients said, test me for Lyme disease. And so by 2004, my practice became exclusively people living with chronic fatigue and fibromyalgia. It just evolved that way. I trained with Jacob Teitelbaum to learn how to do chronic fatigue. So that opened the door to looking at adrenals and thyroid and herbs and supplements even more. So I was combining that with my acupuncture. And so then I tested her, and I did the worst test. I did a PCR test for Lyme. Now the reason, so PCR, for your listener, you probably all know it, but it's a way of looking to see if they have the genetic material of the germ in you. And the trouble is, in Borrelia, Lyme infection, PCR testing will only find Borrelia if it's in you 30% of the time. There are documented studies that show it's just horrid. It's not a good frontline test. The thing about it, when it does come back positive, it's real. You can't refute seeing the RNA or the genetic material of the germ in you. So anyhow, her PCR came back positive, and I thought, oh boy, I wonder if I've been missing this illness in my patients with chronic fatigue and fibromyalgia. So I went back and I retested everyone using a lab called IgeneX and doing what was then their Western blot, which at that time was probably one of the more sensitive, had the greatest ability to detect if you might have Lyme in you. And I found about 35% of my patients in Seattle, Washington, and pretty much a primary care kind of integrative functional medicine practice, 35% tested positive for tick-borne illnesses. And I thought, I'm going to do something about this. And so I decided to start treating it. And once you hang your shingle and go in that direction, especially back then as an MD, that's what I do now. So yeah. Anyhow, that's my story. So it comes out of, and the way I kind of look at, as I said, I started with working with underserved, and a lot of the time that was financial, racial, underserved. My stint in the Senate was definitely about helping everyone to get healthcare access. That's what that was about. And then I really think that these illnesses, what I call the subjective illnesses for which people feel like crap, but we really don't have a test that says you have fibromyalgia or you have chronic fatigue syndrome. And even in tick-borne infections, you may have a test that says you have it, but most of your symptoms are subjective. It isn't something you can walk into the doctor's office and say, I ache, and they can see the ache, right? So these are subjective illnesses. In medicine, conventional medicine especially, just totally discounts subjective illnesses. If they can't see it in the test, or they can't see that you're all red and inflamed, they discount it. So patients with these illnesses are underserved. And so that's how I kind of meet that mission of helping the underdog, helping the underserved as well, too.
Beautifully said. Thank you. There's so much to unpack in what you just shared. So I thank you for walking us through that journey.
Yeah.
Yeah. So first of all, I really connect with this mission to address underserved populations. I kind of grew up around that mission. Father was setting up community healthcare clinics all throughout Arizona and serving, First Nation and underserved populations all throughout that state. So I kind of grew up knowing that mission and having an affinity to it. So
yeah,
it's really interesting shared connection there. And the other thing that I was curious while you were talking, because I was one of these beneficiaries of that early work you did. It sounds like, setting up these community healthcare clinics that are integrative that allowed the naturopathic training to get into all kinds of avenues. Maybe that was the template. And early on, and around the time in your training, there was a chronic condition, and still is a chronic condition, but a really unsolved, life-threatening condition, HIV and AIDS, that was,
Oh my gosh, yes. Yeah.
it was a big, really, it kind of, in the same way COVID turned everything around, that illness turned the science and medical community around. And I'm wondering how much that interfacing with people with HIV and AIDS influenced your work. Because I know for me, it was game changing. And if I hadn't had that experience, I don't think I'd be the provider I am.
Yeah. It's interesting. So I did medical school from 84 to 88, which is at the time we just started seeing HIV. And so my residency then in an urban, underserved hospital had a lot of people with HIV. And the thing that most struck me was just at that time, people with HIV were, ostracized terribly, especially in the hospital. We still had a lot of people living in fear that it was somehow going to jump across the room and infect them, basically. And so the sad part that I saw back then, and I would go in and talk with people. I would go in and touch them. I figured that they needed that, right? But I was so saddened by so many of those people that would die in the middle of the night with nobody with them. That's because medical staff was too scared to be with them, or family members had deserted them. And so I didn't have answers for them back then. We had AZT as a drug you could use and to slow it down, which I used when I worked with the homeless. We were an HIV clinic too. I mean, you had to do everything for the homeless, but it's a different illness now with all the antivirals we have. It's now a chronic illness for most people that their germ is just controlled with, but it's controlled with antivirals. But I think what that just showed me is that the power of infection to wreak havoc within somebody's life. And I think that said to me too back then is I didn't shy away from helping people. I didn't see that as a means to run away just because it's difficult. And so if anything, it kind of gave me more fortitude to even start working with people with tick-borne infections as well too. So yeah.
Yeah. I want to give a shout out to her. Maybe you know him, Dr. Kevin Conroy.
No, I don't know. Yeah.
He was a big part of establishing care for HIV and AIDS within naturopathic training.
Oh, okay.
And he really, like you said, sat with people who were ostracized, rejected.
Yeah.
People had given up on curing them or helping them. And basically people were telling them just, live your life out.
Right.
And to be able to be there and sit with people who are in that state is surely a gift. He wants to be around the winning team.
Right.
And it takes a special person to sit in that space with people that are feeling like they're being viewed as the losing team or the team that's not going to come out of this. So
right.
I think it's just so special what you're doing. And, it really reaches me in a deep level.
Oh, thank you for saying that. I appreciate that. Yeah.
I know that, as you work through your career, and I'm kind of at this place now, like 20 years in, where it's really interesting to put together frameworks and, sort of the patterns that you've seen for many, many years and start to develop some kind of structure and mind frames and frameworks around things. So you've developed something called the Big Four. And I wanted to see if you could take us through what the Big Four is and how it's a part of how you view the work you're doing.
So the Big Four that I consider with my patients are hidden infections, toxic burden, system dysfunction, and brain-body feedback loop or brain holding of symptoms. I'll call it that way. And so, I just kind of use this as a way of making sure that I'm taking care of all of these areas or thinking about all these areas. Now, all of these areas may not be something I'm going to work on with everybody, but so when somebody comes to see me and they're coming in often these days because of my having worked in the world of Lyme disease, tick-borne infections, mold toxicity, which seems like forever now, but people are coming in already with some sense that they may have one of these conditions. You still get the rare person that comes in with chronic fatigue, fibromyalgia, that no one's really broken it down to see what's under that. No one looked to see if it was tick-borne infections. No one looked to see if it was too many yeast in their intestines, or nobody looked to see if it was mold toxicity, right? Just didn't look for it. I'd still get those people periodically. But most of the time, we're going to start in the hidden infections because they're either bringing in testing that shows they might have it, and I don't always think some of the tests that comes in are valid tests. I sometimes go back and want to reconfirm, already thinking about toxic burden, meaning mold toxicity. So when people come in to see, the first thing I do, I just get a good history. What happened to you? Tell me about what was going on in your world when everything fell apart. And yeah, they may describe, I got a tick bite and a bullseye rash and I got sick. They may also say, I got that tick bite 5 years, 10 years, and then I got sick 10 years later. And I'm like, oh, well, tell me about what happened. Where were you living at that time? And I hear these stories of people that they were doing well and they moved into a house and suddenly their health fell apart. And I'm like, okay, well, tell me about your house. What was going on in that house? And can learn some crazy things. So one time I had a patient that came in, brought in by his mother that was a nurse. She's probably about 70 or so. He's mid 40s. And she brought him in because a doctor here in town had done Lyme testing on him. He had severe cognitive dysfunction. I couldn't think. He had lost his job. He'd lost his kids. He'd lost everything, too fatigued. And he'd been seeing a physician here that had done a Lyme test that came back positive. He had some distant history way in the past of a tick bite. And so she just assumed this was Lyme disease. And I just sat and talked with him. I said, so tell me your story. And so basically what happened is he was well until he moved into the house and said, tell me about the house. And he goes, well, we found this aquarium in the back bedroom. And I said, well, tell me about the bedroom. And basically there was black mold all over the place. And it wasn't. I know that was an obvious story, right? But I said, oh, well, we need to look for mold toxicity. I said, yeah, you have antibodies against Lyme infection. Maybe your immune system took care of that infection. Let's make sure it isn't something else, right? And so I did do mold toxicity testing with him, a urine mycotoxin test. I think it was probably real-time labs we used. And it came back loaded with toxins. And I spent 6 months just detoxing him. That's all I did. I did not go after that infection. He got 100% well, and we never touched a tick-borne infection. So one of my teachings here too is a positive Lyme test does not always mean Lyme is the problem. Sometimes maybe our body dealt with it, right? So we have to look broadly. So when somebody comes to see me though, I let the history give me some information. I try to take a very detailed history about what and when. What have you tried? But I'm usually going to look for tick-borne infections using a high-quality lab. Part of the problem in tick-borne infections is your Quest and your LabCorp labs, they're horrid. They're using, for Borrelia, they're using a Western blot something called a two-step method that's been approved by the CDC and the FDA. And that method of finding tick-borne Lyme specifically misses 50% of chronic infections. It's like not even having a test done, basically. Okay. And then the other two big infections we look for is something called Bartonella and something called Babesia. Now, Bartonella may or may not be transmitted by ticks, but there's some feeling among people down at Centers for Disease Control that it may be a fairly ubiquitous infection, meaning a lot of people out there have it, and they're just walking around healthy. And so some of us in the world, it is true that ticks can carry it. We don't have good lab studies that prove ticks transmit it. And so some of us I wonder if the association with Borrelia tick-borne infection is that Borrelia suppresses the immune system, Bartonella pops up because the immune system can't keep it under control. Same thing in long COVID. I have found a number of my patients with long COVID, when I start querying the patient up, there's enough symptoms to me that say, think Bartonella, I look for Bartonella, and that's the ticket that turns them around, for instance, too. So anyhow, I like using, in terms of looking for tick-borne infections, I prefer to use a lab called IgeneX. It's an independent lab in California. Now, when independent labs that don't sell test kits to other labs develop a test, they're supposed to do validation studies, which is how good is their test at finding known cases and ones that don't, and identifying correctly the ones that don't. All right, so IgeneX has done great validation studies, and that's why I use them. Their testing method called an has been shown through their validation studies to have a sensitivity of about 93 to 94%, meaning it can find these infections about 93 to 94% of the time. And what makes them a good test too is that for Borrelia, Lyme, they're looking to see if you have 8 strains versus the FDA CDC method LabCorp and Quest uses only looking for the original strain on the East Coast. And and these days, especially on the East Coast of the United States, we're getting a lot of Lyme from across the Atlantic that comes over. So something called Borrelia afzelii, Borrelia guerini, and they're becoming big out there. So because we're a city that has people from all over, I'm liking the IgeneX method because they look to see if they test against 8 strains of Borrelia. That makes it a better test. For Bartonella, we think up to 15 strains can infect you. And the reason that the Bartonella test through IgeneX is better is they test for 4 specific strains and the genus, the whole family. So they're literally saying, do you have any one of the 15? All right. And then on the Babesia front, which is Babesia blood parasite that can be tick transmitted, they're looking to see if you have the family as well as 2 strains. So what makes their test technique better is they're looking for more strains, basically. All right. So that's where I tend to go there. And usually these days, regarding mold toxicity, if the story says think mold toxicity right away, I will test for it. If the story, it tells me I don't know if they have mold toxicity, often the way I work is I'll look for tick-borne infections first and start working on those. But if we're like 4 or 6 months into a tick-borne infection, I'm making no headway, then I may come back and do testing for mold toxicity as well too. And then there's the system dysfunction. And so all of these illnesses, whether it's long COVID, whether it's fibromyalgia, whether it's tick-borne infections, one of the things that they all do is they trigger an excess of inflammation chemicals made by your immune cells called cytokines. And cytokines are good. They help you fight infection, but in excess, they cause sleep disturbances. They make you hurt. They give you fatigue, all the symptoms. So those cytokines also lead to hormonal dysfunction. And so we want to do things to lower cytokines. I'm wanting to do things to support the adrenals and the thyroid. I need to fix sleep. So that's some of the system dysfunction. And for a number of people, there's a lot of disturbance in the intestinal microbiome. And, as you know, Adam, these days, it's seeming that the intestinal microbiome is the brain of everything now. It's the brain of the brain of the immune system. So I like working to get better balance there. And then finally, this brain-body feedback loop, basically for people with longer-term chronic infection, there is a theory that one of the reasons they may still be ill is that an area of the brain called the limbic system gets stuck in an on position. And the limbic system is what drives you to react to save yourself or to keep yourself out of danger. And so it's if it's overly turned on, you're going to be kind of in this fight or flight response system for a while. But there's 2 major components to it. One of the components of that system is something called the insula. And the insula interprets your body sensations. The other part of this limbic system is called the amygdala. And the amygdala, basically, it kind of lives with this danger feeling, and it can make it so that the insula overinterprets body sensations, triggering more fear. That's how this thing gets locked in. So I'm finding, especially in people that have come to see me that may have had years of illness, I'm starting at the beginning to want to do some limbic system retraining work with them. I may not do that brain-body feedback loop, brain retraining thing on everybody, but especially with people with longer illness. And some of these retraining programs, there's one I like using called Gupta, got independent research showing that by doing training to reset this activated limbic system, that you can get improvement of about 50%, or you can get 50% reduction in your symptoms. And my patients sometimes resist it because it involves meditation, breathing exercises, a bunch of stuff. But I tell them, if I told you I could give you a pill that would reduce your symptoms by 50%, you would take it tomorrow. So I try to bring that point up too. So anyhow, I hope I haven't talked too long here, but those are how I kind of approach those 4 different areas.
Yeah, that was fabulous to walk us through that.
Yeah.
I have a lot of questions and
Sure.
want to push into a few of these topics. I think the first thing I want to reflect back is just it's great to hear the difference between conventional Lyme testing and the IgeneX approach. And I think, for people who've been in this world for a while or are trying to manage their resources correctly, there's always this pull between, do I just follow what the CDC says, or do I push into this lab that's going to possibly catch it but cost more? So is there anywhere that we feel that the Lyme-literate world overreaches and sort of kind of stretches too into the preclinical evidence world where we have to really caution against that as well?
So, I think, well, let me kind of, I want to just take off on one of your points. So it is expensive to sometimes diagnose this. So if you were to do immunoblot testing for Borrelia, Babesia, Bartonella, you're talking around $1,300 roughly through IgeneX, right? But it gives you an answer. And it's going to give you an answer, yes or no, with 93% chance of finding it, okay? I see, unfortunately, that a lot of my colleagues these days are also relying on a cheaper independent lab called Vibrant Lab. And the problem I have with Vibrant's done a great job of marketing to everyone, and it's a cheaper test. They have only adequately validated their Borrelia part of that test. Their Babesia and Bartonella, in my opinion, gives erroneous results. And so you may think I'm going to save money and get my Vibrant test, but in the end, it's going to cost you more in treating unneeded or not treating what needs to be treated. So I hear the point about cost. It is a big deal here, but if you're trying to get an answer about what it could be, I think that definitely on the testing front, in my opinion, the IgeneX is a better way of going. It's the most sensitive way to find it. But I do agree that I think that, in the world of Lyme disease, there's some overreach that I think that happens. Number one, I think that a lot of my colleagues misinterpret a positive test to mean that's the problem. And as I said already, we have to look for other conditions too. We have to look for mold toxicity, which can look just like tick-borne infections. One of the other conditions I'd like to look for when people come in my office is intestinal yeast overgrowth. You can look at, if you have too many yeast in your intestines, it also triggers cytokine excess. And so one of my favorite stories on that front is I had a woman that came to see me from Indiana. I grew up in Indiana, by the way, so I kind of felt some affinity there, but she got a tick bite up in Pokagon State Park in Indiana and had symptoms that looked just like Lyme. But she's like 25, 26 years old. She comes in to see me and she is just loaded with acne. Now, a 25-year-old female should not be all loaded with acne, right? So when that happens, you got to ask why. And Adam, you know this and I know this, but you get intestinal yeast overgrowth due to the chemical disturbances that happen in the intestines. Some people get a lot of pimples or acne that's part of intestinal yeast overgrowth. So I talked with her and I figured based on symptoms and a yeast screening tool I use, it looked like she might have yeast. And I said, yeah, you got this positive test. Yeah, you got a bunch of symptoms that look like Lyme, but I got to clean your gut out first before I can ever go after, because if I put even an herbal antibiotic in you right now, we're just going to make that intestinal yeast worse. I spent 2 months cleaning out intestinal yeast. She was 100% well. And so again, that's another example of, with mold toxicity and yeast, always I use those as examples to say, look, make sure it's, think outside the box. A positive test does not, even if you have a microscope test that says this germ is in you, the immune system could still be taking care of it. So make sure you consider other possibilities. So that's one of the overreaches I think a number of my colleagues do. The other overreach, and I'm dismayed by a number of my colleagues these days. And a number of these are ILADS members, International Lyme Associated Disease Society, but there is increasingly a tendency to go for very unproven therapies in this world. And these are unproven therapies for which the practitioner can make a lot of money and charge people a lot of money. And I'm speaking specifically about a type of therapy called SOT therapy, which is giving people genetic material to block the virus reproducing at a genetic level or bacteria reproducing at a genetic level. There is no research at all showing this is effective. In the Food and Drug Administration in this country has regulated a number of SOT treatments as a drug. And in testing, preclinical testing, a number of those got rejected because they were found to be quite harmful to people. Where a lot of practitioners here in this country are getting their SOT is out of a lab in Greece called RGCC. And there's been no human safety studies done. There's been no true efficacy. And they're charging $3,000 to $5,000 a pop. For an individual infection, people may need up to 3 or 4, supposedly. When I look at the discussion in the ILADS community of physicians doing this, some say, well, I found it effective for this. And other ones are saying, I found it effective for that. But no one seems to, across the board, to find it effective. So anyhow, that's one of the overreaches that I see. There's another overreach going on out there right now, which is a treatment called TruDose. And TruDose is platelet-rich plasma. So you take your plasma out of a person, you spin it down, and what it does is concentrates the platelets, and the platelets are loaded with a bunch of anti-inflammatory, anti all kinds of stuff, right? And then what people are doing with this TruDose is they're injecting it back into their bloodstream to help with Lyme. Okay, now let's think about this. You've spun down your platelets to concentrate the anti-inflammatory germ-killing capability, and then you're going to re-inject it back into the bloodstream where it's going to get all diluted again. Now, PRP may work great in a knee joint for knee inflammation. And if you look at the data on that, that's even questionable whether it does or not. But there are people out there offering this PRP that has no human studies about Lyme disease, and they're offering it and they're making a lot of money. So those are 2 areas I am frustrated by my colleagues right now. And I think a little bit of an overreach and trying to find something to help people with this illness, basically. Yeah.
Great. Yeah. So when hearing you reason through that, I heard a couple things. One is from a lab standpoint, the importance of validation of their panels as something that I think is really important for both practitioners and the patient to really ask. And secondly, hearing that when there is a finding, not necessarily that you don't just react to the infection or the bug that was found and say, okay, now we're going to eradicate that. You still put together the puzzle and figure out what the right lever is. And lastly, I think the component of the last piece you were talking about, if
really unvalidated treatments that have no even preclinical science to show they work.
Gotcha. Right.
Yeah.
Okay.
That are
Okay.
expensive.
And
expensive. Yeah.
Yeah. And so the last point you made about new or therapies that may have no reasonable mechanism and are expensive. So I think I always like people to ask what the mechanism is of the treatment and if it's understood. And that's always a great place with an unproven therapy. Like in a desperate situation where conventional medicine has no therapies to offer and is basically kind of shrugging their shoulders, you do have to go out and seek emerging therapies. It's just part of this world.
Yeah.
But if someone can start with the mechanism, it's always a great starting point. If they don't know the mechanism, or if it seems like it just does not add up, it's a concern.
Yeah, with SOT, a mechanism does make sense that you can use what is called blocking RNA to block at the ribosome. The ribosome is where proteins are made. You can block RNA at a ribosome level to interrupt germ synthesis. Now, that mechanism makes sense. The trouble is it hasn't been studied in the lab as being effective in this germ. And what they're producing hasn't been studied in this germ and this person. So that's where I have a problem. I have no problem using things that mechanistically should work. I'm usually wanting to make sure there at least is some remote laboratory study that actually showed it's plausible that it works too. So I tend to at least want to have a little bit of research. It may not be human studies, but at least some preclinical studies that give some idea can work too. Yeah.
Okay, I want to just push into one more of these areas and then maybe tie some of this all together.
Sure.
Is the mold world. So this is really taken off, and in integrative medicine as a avenue to explore in chronic illness. And there's some findings that you mentioned to suspect mold toxicity, the obvious when people know they've lived in a mold sick home, but you've also explored some of this overlap of all these chronic conditions could be mold, could be mycotoxins. I'm just curious where you're landing right now with testing, because it's a controversial topic, and I don't think anybody really knows the answer personally, but I would love to hear where you're at with that.
Sure. So testing is interesting in this area. So the physician at first founded or came up with the idea of mold toxicity is a physician named Richie Shoemaker. And what Dr. Shoemaker did is he basically would diagnose people as having this condition if they had a genetic profile saying they might be susceptible to something called an HLA-DR test. And also then if they had certain inflammatory markers that were elevated in their blood. Basically, he was relying on indirect testing, meaning no direct measurement of mold toxins in a person. He also would like to see that they had something called a visual contrast study that was abnormal. And people with toxicity may have difficulties distinguishing black and gray on a screen. Basically, that's visual contrast studies. But even if that's abnormal, it doesn't prove it's mold toxins that make it abnormal. The problem I have with Richie Shoemaker's work, because some physicians still do that as their means of diagnosing mold toxin illness, is that there is, and some of this comes out of my work in tick-borne infections, and that is some of those inflammatory markers can actually be elevated because of tick-borne infections. And so I don't find, especially if tick-borne infections are there, that relying on the Shoemaker chronic inflammatory response syndrome inflammatory marker panel is accurate. So I don't rely on that. And again, it's indirect, it's not measuring. Okay, so then there's a group of us, especially in people that work with tick-borne infections, that have tended now to rely more on urine mycotoxin testing. And the idea is if mold toxins build up in your bloodstream, that there's two ways they can get out. One is they will move out into the intestines, but because they come out of the intestines as a fat-soluble toxin, they get reabsorbed right back into the bloodstream. So that's not going to give us, we can't look at poop to really test this stuff, all right? But interestingly enough, it looks like the kidneys will release mold toxins. Now, they're not going to be the greatest organ at removing a toxic load, but they will spill some of these out. And so by looking at a urine mycotoxin test, we get some idea that they may be backed up in the bloodstream, basically. So it's not a direct test, but yet it's of what's going on in the blood, but it still gives you a suggestion that can be there. So I tend to rely on urine mycotoxin testing. The latest idea on the block is to do antibody testing, and it's a lab called MyMycoLab, and they're looking to see if you have IgE antibodies and IgG antibodies. And my problem with that is, again, it's an indirect test. It doesn't prove that you have excess toxins in you. So if we think about how mold toxicity occurs, it's because in 25% of people, they don't develop the right kind of antibodies to attach to the mold toxins so that the immune system does not come in and break the mold toxins down. So measuring, as in MyMycoLab, measures IgG antibodies, and that can give you a suggestion you might have mold toxins in you. What it doesn't tell you, though, is are those IgG antibodies effective working with the rest of the immune system to clear the mold toxins out? It doesn't tell me whether you back them up in you, right? The IgEs on the MyMycoLab, I think, are useful. If you have a lot of IgEs, that probably means you have mold in your environment because that's the allergy antibody. So I'm not convinced that IgG really tells us that you have mold in you. It says you're having an immune reaction to mold, and maybe your immune system is working well enough to break these things down. So at this point in time, I tend to rely on them. But I can see there's no perfect test here. What are your thoughts on that?
Yeah. Yeah, I've gone back and forth between those two labs.
Yeah.
And at certain times, I feel like they have their places. And I'm just sort of seeing at this point which one leads to the best outcomes
Yeah.
and best response or diagnostic confirmation. So, and I've seen both play out, and I've also seen both fall flat. So
Yeah.
it's just a difficult thing. I think, like you've alluded to in this particular episode, a good patient history. I think validation questionnaires that are coming out are really helpful. Just knowing what the patient's already been evaluated for, taking a good environmental history, and mold sickness just has a feel to it. So
Yeah.
as a clinician, once you've seen it enough times, you get to know it.
Right.
So
Right.
yeah, so great. I think this would be a good point just to kind of tie a few things together and close out our discussion. I could talk to you for forever. It seems like it's so interesting.
Invite me back. No.
Yeah, absolutely. Yeah, so I guess the thing that I would like to close out with is just finish with where would be some starting points for someone who's listening to this and they feel like you've described them, like what would be some early steps in their journey? What should they do first and where should they go? And then also if you could tell us how people can connect with you and if you're taking patients or if you have programs or what have you.
So, I think in terms of if you think this speaks to you and if you have symptoms of fatigue and fibromyalgia, based on my experience here, where I found 35% of people had tick-borne infections, I would talk to your provider about requesting one of the things I would suggest is requesting a high-quality test. And that may mean you need to bring the IgeneX test kit box in with you. So you can reach out to IgeneX and say, send me a test kit. They're going to charge you for it, but bring it. And you would want to circle a test called an immunoblot for IgM and IgG for Borrelia, Babesia, Bartonella. That's where I would start. If you have really limited money, just do the Borrelia, because sometimes if that's positive, that can be an indication you might want to do those other ones, okay? Secondly, if you think you have any history of mold exposures, wet building damage actually is what I'm talking about in your history, get a hold of or of Real-Time Lab or Mosaic diagnostic labs. Have them send you a test kit and see if you can get your provider to sign off on that as well too. Okay, those would be two starting points. The other thing is if you happen to have these illnesses and you're still trying to figure out if you want to pay for the testing or if you want to do anything, there's some things you can do. So number one, start trying to get 7 to 9 hours of sleep a night. And often for most people, that is a matter of doing good sleep hygiene, which is set the same sleep time each night, turn off all your blue light devices, meaning your computer and your cell phone, at least an hour before you go to bed, caffeine after noon, stop all alcohol at night. Those are some great starting points. And with that, a lot of people can normalize sleep. And sleep turns your immune system on. Sleep lowers inflammatory cytokines. Secondly, feed your intestines good food. Good food for the intestines, all right? Because remember I said in here, you can get a lot of intestinal microbiome dysfunction, and healthy intestinal microbiome makeup of germs tells the rest of the body to work right, okay? And so I emphasize with my patients that they get polyphenols. Polyphenols are chemicals that you get from what I call the purples. So red, purple, or dark blue fruits and vegetables have polyphenols in them. Coffee is rich in polyphenols. So emphasize those things in your diet. And then emphasize a plant forward, if not plant exclusive diet, because plants are going to feed, and that means beans and legumes too. That's going to give you prebiotic fibers that help your intestinal microbiome. And then I think the third thing that I would consider, especially if you've been sick for a long time, is look at a Gupta program or look at a program called Primal Trust and see if you can break some of that limbic-assisted looping that's going on and you might even get, before you even pay a healthcare provider, you might get a reduction of about 50% in your symptoms basically too. So it'll be a few things. And then finally, in terms of reaching me, I'm glad to help people. So I'm in business here in Seattle, and I do full service visits in terms of telemedicine and in-office visit for any Washington State residents. For out-of-state people, I have a remote consult service where I can describe to you what I think is going on. I can recommend what herbs or supplements or prescriptions you might want to get, and even testing. But because you're not a Washington resident and you don't come and put your foot in my office from a licensing law standpoint, I can't order things for you. So you'd have to find another physician to carry out my plan parts, and the prescription parts, the herbs you could do on your own. And so the way to set those up, there's two resources I'd send your listeners to. If you want to learn about tick-borne illnesses, I have an information site called Treat Lyme by Marty Ross, MD, and that is at treatlyme.com, treatlyme.com. I know we'll probably include it in the show notes. And then
Yes.
off of there, if you want to do a remote consult at the top, there's a button that says book appointment. And what that's going to do is it's going to pull you to my clinic website, which is called the Marty Ross MD Clinic, Functional Medicine and Lyme Disease Center. And that is at martyrossmd.com. And you can look at what I do on there and see if you want to become a patient as well, too. Through the Treat Lyme site, I have a weekly 1.5-hour question and answer session that anyone can join. And a lot of people do a lot of good learning about Lyme disease and what to try, and just doing that format as well, too. So, yeah. So that's what I would encourage people to
Excellent.
do. Yep.
Excellent. Well, this has been a joy to speak with you. I really like your emphasis and your description of what happens to the limbic system and the connection between the amygdala and how it can get kind of stuck in this state. And so it's really helpful for people to hear that you're looking at the whole person and the healing path that is beyond just biology or conventional lab tests, and that you're looking at the systems and how they work together. So I really thank you for being here, and such a joy to meet you.
No, thank you for having me. I appreciate it.
Thank you so much for tuning in to this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from it. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.